Hello, this is your just-in-time, quick 5-minute care plan for Joint Commission readiness. So we're going to go over real quick navigation and how we're going to make this better for our patients day to day. And we're going to have some auditing going on. We're going to have some clinical coordinators, DBEs, managers, looking at these care plans, making sure they're patient-specific, moving forward daily because we want to make sure that this is perfect for our Joint Commission survey. In the past, we've had a history of falling out in this area because this has not been patient specific. And we know that it's clunky and there's a lot of opportunities for improvement, and we're going to be addressing them very soon. But for now, it's all about making it work right now for Joint Commission for our patients today and tomorrow for our survey. So you've been asked to show the care plan to Joint Commission. Don't freak out. You know what you're doing. You've got your plan of care, you have your problems, you have your standards of care. This is not everything though. You know how to show them clinical panels if they want to see the history of pain and what you've been doing. You know where the pain clinical panel is to show them that. You know if they want to know about respiratory therapy or physical therapy documentation, occupational therapy, speech, the recommendations. You go to patient care, you go to provider type, you can look at anyone else that's documented in this chart, case management, you got physical therapy in here, respiratory therapy, anything you need, dietitians in here, all of that. So what can we do to make this patient specific? This should be happening on every single patient. The first thing is to come in here and make sure we add things and delete things that aren't pertinent. So this patient has abdominal pain, anxiety, nausea, and tobacco use. So all of a sudden, we're coming in here and we're going, they don't have anxiety, that doesn't belong there, so complete it, just get rid of it. They don't have it, all right? And it'll go away, and we won't have it in here anymore. We can change our view, get rid of complete real quick, and we don't have anxiety anymore. Great. Maybe they have something we can add. We can go to add. We can look through all the problems here. Activity intolerance, maybe that's going on, so we can add that. We could add some acute and chronic pain. We could add chest pain if that's what they're here for, cellulitis, AFib, constipation, dehydration, depression, high fall risk, GI bleed, impaired gas exchange, all that kind of stuff. So add stuff that's pertinent, take stuff that's not pertinent away. What are we left with? We have the things that actually go on with our patients. We have these A's and these I's here. The A's will show you associated data related to that problem. So for nausea, it'll show you that GI assessment. How often is nausea happening and vomiting? What's going on with it? And you can show that over time with your documentation from physical assessment. The I's show you, under the problem, the things you would see for that problem. So for nausea, this is the stuff you should see. And that's okay. You can tell Joint Commission this is kind of a guide for you in your assessment to look for things with nausea and document these signs and symptoms for the provider and for the care team. The I for the actual outcome shows you things that we're doing for the patient for this outcome. So we want to verbalize decreased nausea. So the I here shows you things that are going on for the patient related to nausea. And I've already edited this, but what you should do is edit here and take away things that aren't pertinent. Because maybe it says in here, we're gonna monitor diet intake, but they're NPO, so get rid of diet. If this was pain and it said we're gonna consult a pain resource nurse and there's no pain resource nurse to consult, or you don't need that, get rid of it. So we're taking away things in here that aren't pertinent, and we're gonna add things that are patient specific. So here I added batching care to minimize disruptions and allow patient to rest, because we're gonna do that. You know, night shift nurses, we're not going to go in there every 10 seconds and bug them if they're in pain and they're nauseous. So, you know, we try and coordinate together so that we can wake them up as little as possible. So we added that. And then above that, we decided, okay, I want to just say something about this patient specifically to make this their care plan. So I said patient states lying flat is the best position to remain comfortable. That way my care team knows that moving forward. So I added that and I save it. And now it's part of their care plan. I can do the same here, tobacco use. Maybe I went in here and I said, you know, it says provide nicotine patch. Well, they don't like nicotine patches, right? But maybe maybe they are interested in quitting smoking. So patient states they would like to try Chantix. States they would like to try Chantix. And that's something we can talk to them about. We can tell the PCP, maybe it's a Dr. Gorell patient, and they swing by and then you say, the patient's really engaged about quitting smoking and they're thinking about trying Chantix. They want you to talk to them about it. So we can just save that, and that could be on their care plan. Perfect, patient specific is what we love. So now we have a patient-specific care plan, and the person that's actually going to be sitting there with Joint Commission over their shoulder can look through these eyes and show Joint Commission, look, we have edited this, we have made this their care plan, not just a care plan. This is John's care plan. This is, Jane's care plan. What else are we going to do? We're on the work list. We're documenting outcomes every shift, but we're not just going to say progressing. This is nausea. We could just say progressing because it's getting better and leave this alone and save it, like we do every day. But we got to add some stuff in here because, they're going to be traced. They're going to look at these. We need to actually talk about our patients, what's going on. So, the patient states that their nausea has gotten better and they're tolerating diet ginger ales. Just something about them to make this a real care plan about a real person. And then when you or someone showing Joint Commission this care plan, you can look at the last done of this item and show them the history, show them where you or your teammate edited the care plan for this patient, and look at flow sheet and show the documentation over time that you've been documenting on nausea. And that paints a picture of a real care plan for this real person and not just something generic. I hope this has helped. Don't freak out about this. Take some time, 5-10 minutes a patient, go into the care plan, click into those eyes, click on the edits, make this really about them, and show that we actually are assessing and talking to our patients and addressing their needs specifically to them. Thank you for your time and watching. Bye.